Well, Dr. Meagher, we have covered a lot of different areas with you over the last few weeks. I suppose the main ones we've looked at is, the upper, the forehead, and then down lower. What about the middle part of your face? I mean, is that an area that people get treated?
Absolutely, that's a very good question, Rach. As you say, we've looked at the upper part of the face, the lower part of the face, and the mid-face is very important because obviously as we age, there's loss of collagen and elastin, and the cheeks begin to fall down. So when we're born, our skin is almost, what's underneath the skin is almost like the collagen is like long spaghetti-o, and big long spaghetti. And as we get older, unfortunately,
Spaghetti-o.
Yeah, or it's like long spaghetti. And as we get older, it's a bit more like macaroni, unfortunately.
And is that from smiling a lot, or
it's just as we age,
the
natural. Obviously, smoking really advances aging, and I'm not even going to go there. But it really does. It does advance aging a lot. But just generally, as we age, due to sun damage externally inside our collagen, our elastin production, it's slowing down.
Okay.
What binds the collagen again together, it's not working as well. As I said, when we're born, long spaghetti, afterwards more like macaroni.
Okay.
So what's happened here is obviously as we age there's two areas that are very obvious in the mid-face. There's loss of volume in the malar eminence, which is basically just in the cheek if we keep it nice and simple. And then what we also have is we have these lines developing here, the nasolabial folds, which is from the outside of the nasolabial folds.
Nasolabial folds.
So from the outside of the nose or the nasale down to the corner of the mouth, you have these lines. Now these lines aren't like other lines that are formed from overuse. These lines become apparent really due to the loss of volume. So the area here is falling down, which is giving the shadow of the line. So the idea is that we would put product along the line to obviously lift it up, but also to almost like a dam stopping the water. So it's almost to push it back,
Gosh.
So
is this a popular treatment?
Very common. Normally patients will come to me and they'll have a consultation. They might have a Botox treatment. Obviously with Shelley there is an indication for some Botox treatment, but we won't be treating her for that today. So normally patients will have some Botox and then we'll move down the face, and obviously the nasolabials is normally second on the list, and then the lift depends whether they're having it.
Right, well let's do it then.
So we're just marking the area that we're treating. Again, it's the nasolabial fold. It's that line from the outside of the nose or the nasale to the corner of the mouth. So I'm just marking slightly outside it, and we'll actually leave the product inside it because obviously we want to almost have it like it's a dam stopping the mid-face falling any further. And again on this side, and again, just marking it just a little bit outside of where we're going to inject. So obviously now we're going to go ahead with the treatment, and we'll be putting product just inside the line, and the idea would be that obviously we can place the product so that it stops the mid-face falling down, but initially we'll put a little bit of extra product just at the side of the nose or the nasale, and then we'll work our way down. So that's the normal way that we'll proceed. So I'm just going to start with that first of all. Okay, so again we're just putting product in at the side of the nose very, very gently and slowly is key, just to add that extra support just in the corner of the nose there, because that's often where this problem starts. You okay there, Pat? Okay, very patient. You feel the product going in a little bit, but it's really very... That's great. And the thing is just slow injecting, and it's all about technique really, to make sure that the patient is comfortable.
Now, as I said before, people can sometimes be a little bit cautious as to what things would be injected into their skin. It is your body, it is your face.
Absolutely.
What is the product that you use for something like this?
Well, what we'd be using here today would be a third generation derma filler, and it's made of hyaluronic A substance. And the idea is that when we're born, you see young babies, they're all squidgy and cuddly and they're full of hyaluronic A substance. It's naturally, when we're all born, we have lots of it. Unfortunately, as we get older, it diminishes like everything else. It goes down, everything's, going down. So what we're using now with these third generation fillers, they're made of hyaluronic A, which is substance that's naturally occurring in the body. After about 9 or 10, 12 months, that is broken down by the body naturally, and it leaves the body of its own accord, because again, it's just putting back and replenishing the hyaluronic A stores in the body with something that's already found in the body.
So how often would you have to do that then, if you wanted to keep that?
Probably just about every 12 to 14 months would be plenty ample to do. And again, the key here is, as well, is just to mention, in the past people say there's collagen and bovine derived collagen. There's nothing like that. We're not using anything like that. They're first and second generation derma fillers. They're from the 80s and 90s.
And that's probably where the worry comes from.
I think so. Yeah. I mean, and I would agree, because nobody wants to put something into their body that's coming from, bovine, obviously. There's different derivatives. So what the product we're using today is it's synthesized naturally, and it's completely mirrored the hyaluronic A.
Okay.
So we're just replenishing
What kind of
it in the
cost
body.
would that be now to get some
have-
similar treatment to that?
To have your filler done in your mid-face, it can be anywhere from €350 up. The way it's charged is per tube, because obviously every tube that's opened is single use for one patient,
Sure.
obviously.
Okay.
So the thing is just depending how many tubes you'll need. So for Shelley, we used one Juvederm 3 on this side and one Juvederm 3 on that side.
So it all depends on
how
the
much,
individual.
yeah.
Okay, super. Well, listen, thank you very much for being our lady
Great
in the seat
patient,
today,
great
and great
patient.
patient.
You're welcome.
Thank you very much. Now, the volcanic